Hello, and welcome to this introduction to essay number 3 for University Seminar 275 Scientific Ethics. In this essay, what I'm asking you to think about is, should cell, tissue, and organ donors be compensated in some way? As we've talked about within the class already, it's illegal in the United States and most of the world to sell organs. Basically, if we take a look at the National Organ Transplant Act of 1984, it basically sets forth that it's illegal to sell transplantable human organs, and so you can't, buy and sell organs for people that need it. But in that law, roughly almost 35 years ago now, almost 40 years ago, it established the National Organ Procurement and Transportation Network, as well as the Scientific Registry of Transplant Recipients, with the goal, ultimately, hopefully, of improving the ability to get organs to the patients that need it. So it's illegal to sell organs. But it is possible, and especially in larger college towns, we can see situations where there is a market for renewable body parts, which can be kind of bought and sold. You can go online and take a look at different websites that are associated with buying hair, long hair, like we've got kind of down here, virgin hair that hasn't been treated with the chemicals and whatever chemicals people put in their hair. Other blood products like plasma and bone marrow can be sold, as well as reproductive cells, things like egg cells, sperm cells, as well as breast milk. And we've already talked about surrogacy within this course. So this idea, sorry, my mouse isn't working, this idea that there are certain parts that are allowed to be sold. If we take this a step further, individuals can basically sell their body in legal ways while they're still living for scientific experiments. We can see that a little bit on campus with, occasionally there are, research studies, mainly from the psychology department or the physical therapy department, where they ask research subjects to, participate, and they, maybe get a Wawa gift card, a Starbucks card, something like that, or, some type of compensation for their time. In addition to that, this would be, giving your body for science. There are also opportunities that you can, donate your time, but basically donate, aspects of your body for education, for both the benefit of you as well as the benefit of training student clinicians. So examples of that, we've got the Dan Aaron Stay Fit program within the physical therapy program on our own campus. It's recognized by the Parkinson's Council. But this is basically an opportunity for individuals with Parkinson's disease to go into an exercise program that has been shown, again, through both scientific evidence, research, and then application, to improve their condition, to reduce some of the symptoms, or at least reduce some of the at least motor symptoms associated with it. Still within this area. Temple Dentistry School, the Kornberg School of Dentistry, has a clinic where, as a teaching institution, they provide reduced fees. So if you go to their clinic, you are going to be treated by a student dentist under the supervision of a practicing licensed dentist, but you're able to get reduced care for that because you're involved with education. So with all of this, we can see that there are ways in which you can kind of legally profit from your body. We can also see, and actually move this out of the way for right now. There are opportunities where we take a look at these deceased organ donations, where an individual has died and has donated their body under the conditions where they can be used for transplants. And again, this is the area that is not permitted for sale. And so if we take a look at this donation process is going to occur within a medical facility and under very tight regulations and guidelines. So it's not a situation where the doctors are going to, choose a patient and then, kind of give them the kind of necessary care to, get them into the state of being an organ donor. This is something that's occurring in a very regulated fashion. It's going to be going on in a way that it's monitored. Generally, the organ donation process begins at or near death, where a situation where the hospital setting reaches out to the donation agency, let them know that they have an individual that is near death, that has expressed an interest either verbally or the opt-in on your driver's license, and then notify them, and they may keep the body in a state of life support during this process of evaluation. Once the organ procurement organization is notified, they are going to check to confirm that this individual has expressed an interest in organ donation. They'll often reach out to the next of kin to either gain consent or confirm that, and then they're going to review the medical records and search for recipient matches. They don't just harvest organs to harvest organs. They're only going to harvest the organs that are needed for direct transplant. And so they're going to look at whether or not they can use that body. And then finally, and probably importantly, it is a separate transplant surgical team that comes in and recovers the organs and prepares them for the transplantation process. So it's not even the doctors that were previously treating the deceased that is involved with making the decision for organ donation or actually collecting the tissues associated or the organs associated with the transplantation. So it's highly regulated because you need to have these organs in a very safe, protected and controlled environment so that they can actually be used safely in transplantation. Now, oftentimes, as we've talked about, individuals have died in a way that they either have not expressed an interest in organ donation or they've died in a situation where organ donation for transplant is not possible. But what we see is that many times these individuals may kind of voluntarily, I'm just going to get rid of this for right now, may voluntarily donate their bodies to science. And we see that oftentimes this is associated with families that can't afford funeral costs. If we take a look at the national median cost of adult funeral, and this is based on the National Funeral Directors Association statistics from 2019, you're talking, $10,000, $15,000 in unexpected expenses. It's not something that many people plan for. It's not something that, many people have the ability to pay, kind of right off the bat. And so that, puts, a coercive strain on families that are trying to figure out how to be respectful to their loved one who has died, but they don't have the financial means to be able to, cover the costs of a funeral. And so what we can see is that many times these funeral homes have information about organizations that collect bodies for science. And the funeral homes are often going to get referral fees associated with it. If we take a look at this, bodies that are donated for science cannot be used for organ transplantation, but deceased bodies, cadavers, have been used throughout history for a whole variety of means. As we've talked about again within this course, cadaver specimens are used to train clinicians. We've got a diagram over here, a woodcut from 1555. So, 450 plus years ago, training clinicians, training doctors in a process of dissection. Body parts can be used to train specialists. And so, people that are orthopedic surgeons or physical therapists that are specializing in a shoulder or in a knee will get, cadaver shoulders or cadaver knees that they can study and look at the biomechanics and look at the kind of the insertions and all of the things that are going on. In addition to that, there often a need for research cells or tissues. Again, not for transplantation, but for advancing scientific research. And so what we can see is that they're basically the equivalent of non-transplant tissue banks, organizations that can collect the bodies and then serve as a middleman, or at least a middle agency, between the donor and the scientists doing research or the educators that are teaching clinicians that need these body parts. And so what we can see is that there's actually a market then for these tissues from deceased individuals. And there's a benefit for the donor, for the donor's family. They often get the costs associated with the donation covered. They get cremation, which is often thousands of dollars in expenses. The cremation is going to be covered by the non-transplant tissue bank, provide them with the ashes and an urn and all of that, as well as death certificates. And so they're able to basically dramatically reduce the cost for the families with the deceased loved one. If we take a look at these non-transplant tissue banks, because they're not involved with the direct kind of movement of body organs and body tissues from one individual to the next, they don't have the concerns associated with tight regulations and safety and control that we would see with organs that are going into somebody else's body. So there are no federal laws, very few state laws associated with it. But these non-transplant tissue banks are able to sell the cells, tissues, and organs, and often full bodies, these full cadavers, for medical research and education. And so there are some for-profit non-transplant tissue banks, a number of non-profit non-transplant tissue banks, but they are funding their operations and paying their staff based on the revenue that is coming in from the sale of these deceased body structures. Now, the American Association for Tissue Banks is an organization that accredits these tissue donation centers, these tissue banks, and they provide, again, these standards or guidelines that, in the absence of federal and state laws, are trying to, kind of regulate or at least control what's going on over there. And so some of the things that they provide within their standards are, respect and informed choice for the donors, that they're not being strong-armed or coerced into the donation. A lot about tissue safety to avoid contamination so that these cells, tissues, and organs can be used in science, because if they've been contaminated in some way or damaged in some way, they're not valuable scientifically. And they also establish very firm guidelines for record keeping and tissue tracking. And this is needed for the scientific integrity of their work, because it gives you the history of where these cells or tissues or organs are coming from, and what is going on in the individual that donated them. Is there, were they experiencing some type of illness? Do they have some type of condition that would impact on the cells that are being taken a look at? And so within this essay, what I want you to consider is, should cell, tissue, and organ donors be compensated? And so, as we've talked about already, a big need for organ transplants. We also have a big need for healthy cells, tissues, and organs, in some cases diseased cells, tissues, and organs, for biomedical research and education. And so we need them, whether we're using it directly for transplantation or to better understand the body. At the same time, we have individuals and their families that are in impoverished conditions that would benefit if financial incentives, if financial incentives or other benefits are available, they would be, at a better position. And so what I want you to do is write a short essay, again, 500 to 750 words, roughly 2 to 3 pages, in which you are considering if a person truly has the right to choose what happens to or with their body. Should living donors or the family of deceased individuals be able to sell their unneeded cells, tissues, and organs? And to kind of start this off, I've got a series of prompts. And what I'm realizing is that when I provide these prompts, sometimes you feel that I'm providing coercion, that you need to answer the questions that I'm putting. With these prompts, I'm just tossing something out there for you to consider. You don't need to use any or all of these. My idea is that, if you're not sure where to start, here's some ideas to start with. And so some different ideas. What would be the appropriate level of compensation for a living donor that wouldn't be viewed as coercive? What incentives are appropriate for a family of a deceased donors? For example, should deceased donors be compensated with reduced or waived funeral expenses? Or is this even coercive? Is it ethical to offset the high cost of medical treatment for patients in organ failure by insurance companies or government to pay for tissues and organs to increase the supply? So it's illegal to, kind of buy and sell it, kind of on a black market or, the medical marketplace, if you want to think about it like that. But what happens if there's a government intermediate that regulates it? And so there's, a set market, it's not, free market economy, it's controlled by the government. But again, it kind of eliminates a lot of that, hopefully, potential for coercion. And then finally, what does it mean for equitable What does it mean for equitable access to life-saving organs if it is possible for those with means to bypass the waiting list, procure their own donor, and then schedule their transplant? And so again, you don't have to answer any or all of these, but just something to start, kind of plant the seed, in this case, the seed of an idea that you can use to answer this question. As always, if you have any questions, please do not hesitate to reach out to me. Thank you, and have a great day.